there's some love-hate here with Advantage plans. Coming from healthcare, Medicare didn't even know what prevention was way back when, but they're starting to understand that a little bit more. But the Advantage plans have a lot of preventative medicine in it. They want you to go to the doctor. They'll call you up.
Good morning, HR. I'm Mike Coffey, president of Imperative, bulletproof background checks with fast and friendly service. And this is the podcast where I talk to business leaders about bringing people together to create value for shareholders, customers, and the community. As more employees choose to work past age 65, HR professionals are increasingly being asked by those employees whether they should get on Medicare or stay on the employer-provided insurance. And full disclosure, I'm the HR guy who spent my whole career running away from anything related to benefits. So to discuss what employers need to know about Medicare, I'm joined today by Nicole Morgan. Nicole is a seasoned healthcare professional with over 2 decades of experience. She has clinical expertise as a registered occupational therapist and is a licensed independent insurance agent. She's the founder of Morgan Medicare Solutions, a firm dedicated to guiding individuals through the complexities of Medicare, ensuring they make informed decisions tailored to their unique needs. Welcome to Good Morning HR, Nicole.
Thank you so much, Frank, for having me. This is, well, you said a lifelong dream, but yes, it is kind of a dream to be able to talk to a good audience of HR professionals. I'm actually really enjoying going to be able to do this.
Well, thank you for joining us. I really appreciate you making time. Yeah.
Thank you for having me.
So let's start with the business case for why HR professionals even need to know anything about Medicare. Because, wouldn't the safest bet be just to say, nope, I'm sorry, I can't give you any advice on that if an employee asks?
Well, I've had that happen a lot. And first of all, no one prepares you for turning 65. Most people are thinking about retirement at that time. And then you've got this federal insurance, and the government doesn't even prepare you of what to do first, second, and third, and how to plan for it. And so, yes, I think that HR professionals play a key part or a role in this to take care of the employee, to at least get him to the next level, and to work with a very knowledgeable insurance broker to help guide them along the way, understanding what they have to do as an HR professional and also what the employee has to do. So I think yes, I think the HR professional needs to know just a little bit of how to get that employee from point A to point B and then leave it there. So they don't have to know everything, but they have to know just enough to kind of take care of that employee the right way.
Well, let's try in the next half hour to give them just enough.
Just enough.
And let's say, okay. So first of all, we've got Medicare, A, B, C, D, E, F, G, H, I, J, all those different parts of Medicare.
Yes.
And it's always confusing to me. I have got a 96-year-old grandmother who I help manage her affairs, and she's on this Advantage plan thing. And then when we need to use stuff, we do. It's always, so help me understand, what are the parts of Medicare?
Okay, so make it really short and sweet. Part A is your hospital coverage. Part B is all of your doctor visits, your medical procedures, outpatient surgeries, anything that's outpatient. Part C is the Advantage plan, otherwise known as the Medicare replacement. So Part C is the insurance plan. It is an option of Medicare itself, okay? Then Part D is the drug plan. And so those are the parts of Medicare. Let me go back to Part C. This is the most confusing, misunderstood part of Medicare. In Part C, it's an insurance plan, much like your group health plans, but just for one individual. In that Part C, you have the benefits of Part A. This is Medicare algebra. You have the benefits of Medicare Part A, Medicare Part B, your outpatient, and Medicare Part D. So you have all of those parts rolled into one Part C, and it's with an insurance company. So Medicare itself is not the primary payer. An insurance company is.
Okay.
So those are the four, A, B, C, and D are your four main parts of Medicare. So when people talk about, do you have Medicare? They don't really talk about, do you have just part A or part B? Medicare is A and B together. That is your foundation. You have to add the other parts.
What's the advantage of Medicare Advantage? I mean,
That's a
why would you do
loaded
that?
question.
Yeah, why
Such
would
a
you do
loaded
that
question.
versus Part A and Part B and Part D, just doing those?
So for me and in my business, I go with plans that work with original Medicare, and I do plans like the Advantage plan. I do Part C, but a certain type of person, even in certain states and certain areas, someone may fit the bill of, and they may like an Advantage plan. Some of us coming from group health we don't mind a small deductible or a maximum out of pocket. These plans are attractive to a lot of people just because they have low to no premium. Regardless of what plan you choose in Medicare, you have to pay the Medicare premium. And we're
Okay.
getting into the really weeds of it. But
Okay, so
going
but here,
back,
that's
yeah.
news to me. A and B have a premium.
No, A doesn't. If you've
Okay.
worked 40 quarters or 10 years, that's how you
Okay.
qualify. And now, if you
Okay.
don't qualify yourself, let's say your spouse worked and you didn't.
Okay.
Okay. And I have that happen a lot. Well, you can qualify under your spouse's work history for
Okay.
Medicare. Medicare Part A, if you qualify, doesn't have a premium,
Okay.
but Medicare Part B does. It has a monthly premium and
And
it's
B is your
based.
doctor visits and things like that, right?
Yes,
Okay.
yes.
Okay.
It has a monthly premium. The base premium for that is $185 this year per month.
Okay.
Here's another HR where it's good to have this knowledge is that our high earners have to pay more. They have to pay what's called an IRMA. She's not nice. It's an income related monthly adjustment amount. And you have to pay more for Part B, and you also have to pay an adjustment on top of whatever your Part D is. So you're paying more for that. But whatever plan you choose in Medicare to have, whether it be to stick with original Medicare and have a supplement to help you cover the rest that Medicare doesn't cover, or you stick with the Advantage plan, you will always have to pay your Medicare Part B premiums.
Okay. And then, but if I go with Part C, that
Mm-hmm.
replaces A and B. Is that right? So
You
I won't pay the premium for Part B. I'll pay the premium to an insurance company for Part C. Is that right?
Nope.
Okay.
You
Of
will
course it's not. This
always,
is the
of course,
government. Yeah.
no. So let's just make it really confusing. You still have to forever pay what you owe on Part B. You
Okay.
have to have enrolled in Medicare A and B to get a Part C.
Oh, okay.
And that Part C, the Advantage plan, may have no premium or it may have a low premium.
Okay. And it's just got
Okay.
more benefits. Is that what it comes with? Or what do
Well,
you
that's
get
what,
for that?
well, if you don't use that Advantage plan, let's say you're really, really healthy. Okay. And I'm going to let my pure healthcare experience talk
Sure.
here. If you're really healthy and you don't use the hospital system, well, then there's an advantage to you because you're not paying a monthly premium for that plan.
Mhm.
Okay. These plans are similar to your group health, HMO, PPO. Okay. They're going to have networks of doctors. If you just go see your primary care physician, you may not have a copay for that and everything's covered. But when you're sick, when you have cancer or dialysis, you're going to be
Break your
paying,
hip?
break your hip, there's going to
Mm,
be copays for everything,
okay.
all adding up to a maximum out of pocket. Some of these maximum out of pockets, they're different in every state and they're different within one carrier. One carrier can have 14 Advantage plans. Okay, let's just throw out that number, and every one of them are different. All the copays that you pay on an Advantage plan add up to a maximum out of pocket, and your plan will only pay 100% if you meet that maximum out of pocket. that maximum out of pocket can be in the ballpark of $14,000 on some of these plans. And on when you're really sick and have cancer and or dialysis, you're paying 20% at a time at a treatment
Hmm.
for the and so
Until you get to the 14K or whatever
until you get to the 14K. So I've had people with cancer on an Advantage plan, and yes, they're spending that amount of money each year. Where I feel like, and this is just my personal opinion from a healthcare perspective, is where these plans break down, where it's costing you more money and you tend to get more denials is when you're really sick and you need a skilled nursing
Mm.
facility. That means you cannot go to an inpatient rehab hospital where you can get 3 hours of therapy a day. You've got to still have therapy and nursing care, but you go to a lower level with this skilled nursing. I have seen Advantage plans only approve 7 to 10 days,
Hmm.
whereas Medicare will allow you to have 100 days. I rarely see people on an Advantage plan get to that many days. So that's where I see they break down and costing you more money, because if you get denied, past 10 days, you get to pay full cost if you feel like you need to stay there.
Okay, so I'm demonstrating why I ran away from benefits my whole life because but I can stay in Part A and Part B,
Mhm.
pay a monthly premium of $180, and it sounds like have better hospital coverage than I might have under an Advantage plan. Is that right?
Pretty much, yes. So
Okay.
if you stayed at this point, now we have big disruption right now in the Medicare industry. We've got Advantage plans being scrutinized by the government, by the fraud, waste, and abuse, and trying to crack down on that. But as it stands now, to navigate the health, and this is how I talk to my clients, to navigate the healthcare system, the smoother ride is through just original Medicare and a supplement, which is also called a Medigap. It fills in the gap that Medicare doesn't cover, namely that Medicare Part B, because you got that 20% left over. Then you
That
can
makes sense.
see any doctor in the country that accepts Medicare, because that's the
Mhm.
federal insurance. Then that Medicare pays, and then you have a secondary that pays the rest. So if I'm in Dallas and I need to go see a specialist for my certain diagnosis in Oklahoma City, and I have a Medicare, original Medicare and a supplement, it's easier to go find a doctor that accepts Medicare that way versus the Advantage plan. Saying that there's an advantage to the Advantage plan, you really
Yes.
have to dig down and say, how does this particular plan, in the event of a catastrophic situation, going to navigate the healthcare system? And
Right.
so, that's what I spend a lot of time doing, is kind of digging down to that person's, what do they want? What can they afford? And how do they want to navigate the healthcare system in catastrophic situations?
So, and I promise I'll get off this. I just still want to try to figure out then if we get in that position, then I mean, I'm trying to figure out what is the reason for the Advantage plans. What would drive me as let's say because I'm 65 or 75, and I mean, let's face it, something could happen tomorrow, and I would need that more comprehensive hospital insurance. Um, why? And I'm still going to be paying my Medicare premiums, right? Even if I go with
Hmm.
an Advantage program.
Hmm. Yeah.
So, is the doctor network better on these Advantage plans? Is
It
generally, or
depends
what's
on where you
the
live. Every plan is different. So in big cities, like I said, I'm licensed in 31 states. So I find that in like Los Angeles, it's Advantage plans are there's a lot of them to choose from. A lot of doctors buy into those networks. In Florida, same thing. And Medigap plans tend to be more expensive in those states. So those I tend to think of those as Advantage plan states. But there, you pay your Medicare Part B premium when you're on these Advantage plans. They're different in every state. Restate your question. I'm like losing my train
well,
of thought
no,
here.
yeah, I'm just trying to figure out why I want an
Oh
Advantage
well,
plan. Yeah, yeah.
you there's some people that will choose them because let's say their retirement is very very little and they cannot afford a supplement. In most areas, like a supplement is going to run just under $100 to over $100, let's say, for someone turning 65. Okay. Depends on male,
Okay, so that's
female.
like the Medigap or that
Medigap.
gap insurance. Okay.
It picks up the remainder of what Medicare doesn't cover. Some
Okay.
people just, they're used to something like a group health, and so it doesn't bother them to pay copays. An Advantage plan was designed to try to save Medicare money. Now that has yet to be proven that it really saving Medicare money, or are we draining it dry? But these insurance companies are being paid by Medicare. So it was a way for Medicare to try to control their spending, because they're spending a lot of money when people get really sick and they're in the hospital a long time. So they looked to the insurance industry to say, hey, you have a better handle on claims and keeping costs down. We're going to pay you X amount of money per beneficiary when they sign up for your plan. It's your job to budget that money. And if you can keep them out of the hospital, and so therefore these Advantage plans started adding more preventative care. Now, I'm going to ride the fence here as a healthcare practitioner. There's some love hate here with Advantage plans. I, coming from healthcare, Medicare didn't even know what prevention was way back when,
Mm-hmm.
but they're starting to understand that a little bit more. But the Advantage plans have a lot of preventative medicine in it. They want you to go to the doctor. They'll call you up. So there's some aspects of it. It just really depends on that person, their financial situation, and their understanding of how the plan navigates the healthcare system.
Okay, so
Really.
I'm sold, and I've sold. So all I know is that I've got to get an expert. When I just turned 56. I've got 9 years.
And it's
Please be,
all going to change.
yeah, but please be in business in 9 years, Nicole.
Yes.
That's what I'm asking,
Yes.
so that I can call you in 9 years.
Yeah.
Okay, so let's move on, because I think we've probably caused multiple motor vehicle accidents because people fell asleep while I was trying to figure that out while they drove. So credible coverage. That's a term you
Yeah.
hear a lot when it's related to employment. Explain what that means.
So, credible coverage is when your employer group health plan provides equal or greater coverage, and it's really than Medicare does, and it's really pertaining to the Medicare Part D. I have had, just to give you an
So that's the
example,
prescription coverage, Part D.
prescription drug
Okay.
coverage.
Okay.
Think of
Okay.
D for drugs. Okay,
Okay.
Part D, and I don't know if you can understand me,
I
but
think
D
of
for drugs.
Amsterdam for drugs, but okay.
Yeah,
Okay.
there.
Yeah.
Okay,
Okay.
D for drugs.
Okay.
That's Part D. If your employer has credible coverage, then you can stay on you don't have to get a Medicare Part D plan. But I've got some group healths out there, some clients that have received a letter and their group health is not credible on their drug coverage. If a person is eligible for Medicare, let's say they're past 65 and they're working, they should receive a letter from their employer stating whether their group health is not credible or not. Okay. If it's not credible, then they have to enroll in a Medicare Part D plan. And those letters should go out by October 15th of every year. Why? Because that's the time they can get an Part D plan between October 15th and December the 7th, too. So we want to, but they can, they'll get a Part D. They can still use their coverage on their employer health. They just don't, their employer health just doesn't offer them equal or better coverage. And next year, we had the previous administration pass the Inflation Reduction Act in 2022. That's going to affect the credible coverage on some of these group health plans. And so it's real beneficial for HR personnel to kind of understand that and understand what they have to do, because you have to enroll in Medicare Part A. You don't have to fully enroll in Medicare to get a drug plan. You have to at least enroll in Medicare Part A to
Okay.
get a drug plan.
And so that letter of credible coverage, is that something the broker usually handles for the employer, or is that something somebody in HR actually should be actively,
I think the employer
working?
sends that out
Okay.
to, and they can work with the broker to make sure that
Mhm.
it's credible.
Or
I
the
think there's
carrier, but the carrier's not
carrier.
going to do it, or the
No, the
broker's not going
employer
to.
should
Okay.
let the employee know that whether they have credible coverage or not. Here's where HR personnel comes in. They need to know if it's not credible, what does that employee need to do? You can't just leave them hanging.
Right. So what do
So,
they need to do? Yeah.
well, if they can still use, if their group health is over 20 employees, they can still have their group health be their primary. But if they're credible, if they don't have credible coverage for their drugs, they need to at least enroll in Medicare Part A and get a drug plan.
What is, you said primary, so I assume there's a secondary. So what is primary and what does primary mean?
A primary means that the group health, if the group is over 20 employees, then they can make the group health, that's what's going to pay first.
Oh, okay.
Medicare is not a great secondary at all. So you don't really want to have full group health that's credible and
Hmm.
take Medicare Part A and B. There's a myth out there that people kind of buy into is that, oh, when I'm 65, you have to get on Medicare. And that's not necessarily true. You have to do a legitimate evaluation. And what I do is I'll evaluate everything they've got in group health and the number of employees, and I'll evaluate cost, coverage, everything, and compare it to what we can get in Medicare. But being primary means that group health is going to pay first.
Okay. And that's 20 employees or more is where
Yes,
the health insurance. So if you've got a smaller number of lives in a smaller organization, then Medicare pays first.
that's right. Yeah.
And what happens? Does that make a difference for the employer, the insured, as to the quality of care or the availability of
No,
doctors or anything? It's
no, doesn't affect quality of care. And as HR, you cannot force somebody. You can't say you can't bribe them to go to Medicare. You can't do that. What you can do is connect them to a broker to compare, the group health plan versus what is offered in Medicare. And I think every eligible employee should have that comparison. Sometimes it's better for them to stay with their group health, and sometimes it's better for them to go to Medicare. But at least they're dealing with the upfront knowledge on that. And then it kind of removes you as the HR professional that you're not forcing them. You can't send a letter and say you have to go on. But if their employer's over 20 employees. If they're under 20 employees, then Medicare has to become the primary. At that
okay.
point, I would probably advise someone to go full on Medicare and drop off of that group health because Medicare has to be the primary. So might as well just go fully on a Medicare plan at that
Okay.
point. Because your group health, you don't know how it's going to operate as a secondary either. Typically not a good one.
And let's take a quick break. Good Morning HR is brought to you by Imperative, bulletproof background checks with fast and friendly service. By bulletproof, we mean that our clients can take the information we provide to the bank. We don't cut corners to make research faster or cheaper. We use technology to augment our well-trained analysts, never to replace their experience or judgment. And we offer the most thorough and compliant background investigations available. If you're not sure that's what you're getting today, we'd love to talk to you. You can learn more at imperativeinfo.com. If you're an HRCI or SHRM certified professional, this episode of Good Morning HR has been pre-approved for 1/2 hour of recertification credit. To obtain the recertification information, visit goodmorninghr.com and click on Recert Credits. Then select episode 207 and enter the keyword Medicare. That's MEDICARE. And if you're looking for even more recertification credit, check out the webinars page at imperativeinfo.com. And now back to my conversation with Nicole Morgan. So it sounds like we never, whether it's Medicare or our group health, we don't ever want to be relying on secondary coverage to
No,
as
just
a back.
find out the full story and
Okay.
and go with full coverage. And I have had people that and have had group health coverage, credible group health coverage, and I said this earlier, they take out Medicare A and B. So they're actually paying for two insurances. And some people just have this thought that, well, I'm going to be double covered. Well, what I have found too is when that happens, sometimes there's some confusion in billing, in medical billing. And sometimes if, oh, Medicare accidentally got billed, first and they paid, well, then the group health doesn't pay,
Mm.
So there's nowhere that states that it's a good thing that you have credible group health coverage and be on A and B. And there's no stated rule that says you have to have A and B. What I can urge everybody to do is just get your employee with a legitimate somebody that like, and trust their knowledge in Medicare to help guide that employee the right way.
Okay, perfect. So if I'm 64 years old and 9 months, so I'm coming up on my 65th birthday, and I go to HR and say, okay, so what do I do here? How do we coordinate all of that?
So they need to, at that point, I don't think it's, I think there's some missing education out there. I don't think HR professional, I think
I'm
they get
evidence of that.
slighted.
Yeah.
Yeah, slighted on the education. And I think y'all have such a crucial role. And, but I think if, they're 3 months away from being 65, that's the time to say, hey, I think you need to get with a broker. Or just at least, because I've done that. I've gone into employers, especially at their open enrollment for their group health. And I've given presentations for all of their eligibles and say, okay, this is what you need to do. This is the timeline. Planning for retirement or Medicare is like a wedding. There are months that you need to do certain things.
Okay.
And so 3
So is 3
months.
months enough, or does it need to be further back? Okay.
Yeah. 3 months is enough. So if you have an employee that's planning to work past 65, I still think 3 months before you turn 65 is a good idea. And you may have to meet multiple times just to absorb the information with a broker, but I think it's good planning. We we forget this little part of planning in retirement. I think HR is a good bridge to connect.
So 3 months out, we start talking to a broker. Can I just at any point after I turn 65, if I try out, my group insurance and I want to go to Medicare, are there limitations about when I can
Mm-mm.
enroll in Medicare, or
Nope.
can I just do it at any time?
It's a life qualifying event
Okay.
because you're eligible for a whole nother insurance. Now, in fact, I was rushing here to this podcast today because I just got finished with an appointment with this very situation, and I'll guess maybe that'll help to describe it.
Okay.
It was a sheriff's deputy, and he worked for one of the counties in my area. And we'd already talked when he was thinking about switching jobs. He was over 65, and he decided to keep the county's insurance because it was given to him, didn't cost him anything. But now he has reconsidered. He has cancer and he's reconsidered. Wants to go on full on Medicare. So all he has to really do, we already had Part B in place, and he's within his 6 months of getting that Part B. That gives him a whole nother rabbit hole we won't go down. But we ended up transitioning him into full Medicare and qualifying him for a drug plan for a special enrollment because he's going to drop his group health. So you can get on Medicare if you decide to retire. What if you get walked to the door? What are you going to do?
Mhm.
You
Right.
know, so you can get on Medicare while you're working, and you can continue to work if you need to. But a lot of this just takes planning. It's a special enrollment, life qualifying event. You're not going to get penalized. But then again, it's real important to get with a broker that understands the rules, because the rules, we get tested on them every year. Every year. And every year, something changes every year.
Right.
But I just think HR is a good partner. They need to know when to go see a broker, and then they need to know they're not going to get penalized at all. I want to
And
bring
so,
up, go
yeah.
ahead.
Well, so a life altering event, that's what a life qualifying event
Yes, a
would
life
be
qualifying event.
uh, change of employment, diagnosis. Is a diagnosis as, I've got suddenly I find out I've got cancer or something, does that qualify, or what's a life qualifying event? Or is that the kind of thing where HR just says, yeah, that sounds like a pretty big thing, go talk to a broker, and HR just needs to know if it's, if somebody wants to make that change, they need to go talk to an expert.
I would kind of leave the diagnosis out, because those are not, I wouldn't. That's like if they are eligible for Medicare,
Hmm.
maybe they want to compare how that cancer treatment's going to compare with the group health versus original Medicare. And that's
Okay.
something that I
Right.
could explain too, but it's not considered a life qualifying event. That's a personal decision.
Okay.
But if someone wanted to get off of their group health for whatever, reason, past 65, if they're retiring, the timeline to when you're planning your retirement and your exit from your company, you need to plan at least 2 months before the last date of your group health coverage, so that we have enough time to review options and enough time to process the application and apply for Medicare itself. So timing is everything. What if someone happens to be walked to the door? I had a call the other day. Someone got laid off. They're eligible for Medicare. So my assistant, we go into like high gear. What part of Medicare do they already have? Do they have any part? Do they have a Social Security account set up? That's something you should tell every employee. Make sure you have a Social Security account, ssa.gov. Everybody needs that account.
The ability to log in to
Mhm.
ssa.gov and okay, yeah,
Yep. And
right,
just
yeah, because
even
you can, and
see
yeah, you can
if you.
see even now what your
Yep, I
benefits.
qualify for Medicare. I've worked my 10 years and 40 quarters, so
Yeah.
it allows you to do that. But, make sure that you're planning just right. But you're not going to get penalized if you fall off your group health, still work, go on to Medicare.
Okay.
You just have to
So
plan it.
if I'm going to send somebody to a broker, is the finance? I mean, and forgive me here, but is the incentive not for the broker to sell me an Advantage plan?
Oh,
Uh,
yeah.
yeah,
I'll
and
tell
so
you.
okay,
I
yeah,
will tell you straight up, just so everybody knows, people get paid more on Advantage plan.
yeah,
They
okay.
do.
So, well, but if a broker sends somebody down the Medicare A and B route,
Hmm.
does that broker make anything on that deal? Does the government pay them money, or how does that work?
No, so
No.
I don't get paid. I help people sign up for Medicare A and B just to
Uh huh.
kind of navigate through their Social Security, because people get freaked
Okay.
out if they, go on a government website and they're afraid they're going to, answer the wrong thing. Okay,
Yeah.
but I don't get paid for that at all. And
Okay.
all of my services and helping people decide and navigate, I don't charge for that at all. And most brokers do not charge for that. I get paid directly from the carriers that I'm contracted with. So if I'm contracted with an insurance company that sells Advantage plans, I will get paid a certain amount of money for that. And then if
Hmm.
I am contracted with a company that sells Medigap plans, supplements, or drug plans, they're taking away all of our commissions on drug plans, but that's just an added service that definitely is needed. You should really help somebody with their drug plan. But we get paid with the policies, a commission off of the policies that we sell. And yes, to answer your question, there are agents and companies that primarily drive the Advantage plan. Not that that's a bad thing, because there are some good Advantage plans for, people, and that fits them and it fits their situation. But you should also pair it with some other protective policies to help, because who's going to pay that big maximum out of pocket eventually? It's
Right.
going to come out of your retirement income. So you want to make sure that you are surrounded by other protective policies for cancer, heart attack, and stroke, the big major diagnosis, to help offset. And so you don't lose your retirement if something catastrophic comes.
So, of the population in general that you see, what percentage ought to, the wise decision, at least on the surface level, appears to be go with an Advantage plan versus just go with A and B? Is it a 50-50, or uh, what do you think? What do you think? How often do you end up telling somebody, you're talking to somebody, then they make the decision? Yeah, the better plan is for me to do one or the other.
Yeah. So As a whole, as a nation, it's probably 50-50. I think that the drive is more towards the Advantage plan. I mean, well, think about it. You get these people, that are eligible get a lot of mail. They get unsolicited phone calls. You get the TV commercials. You get everything, just putting that in your mind over and over and over, not knowing the details. So I think the drive is there and the push is there. Um, because Medicare's getting away from paying the claims,
Hmm.
and they're trying, but I think it's overall 50-50. I think it's honestly different in every area. With my personal client base, I'm heavier on the original Medicare with a Medigap versus the Advantage. But you also have to take into consideration where I live too.
Hmm.
I live in a rural city. I would call it rural, outside of Dallas, Fort Worth. Okay.
We
So
prefer Fort Worth, Dallas, by the way.
Fort
Yeah.
Worth, Dallas. Okay. Fort Worth, Dallas. I'm good with that. I love Fort Worth. But towards my area in the southern Oklahoma, you're going to be real heavy supplements because they cross the border,
Mm.
that sort of Advantage plans don't typically cross borders and go into
Okay.
other states. So you have to pay more on PPO and you have to access a national network and all that. But when you get into the bigger cities, you're going to find more doctors and more doctors in the network that'll buy into the Advantage plan. Now, you're going to have some ups and downs in the Advantage plan world. You take on a risk when you sign up for that plan. And the risk is this: I will take Fort Worth, Dallas into consideration here. We had a major hospital system, I'm not going to name names, major hospital system stop taking a major Advantage plan. So every one of my clients that were on that major Advantage plan, I had to change them or they had to change their doctors. So that is one of the risks on taking an Advantage plan for people. You've got network changes that can be out of the blue in the middle of the year. And there's nothing you can do except hopefully change your doctor.
Find a doc that's part of
Hmm.
the network.
Yeah.
Okay, well, so it sounds like the things that HR needs to do is, first of all, understand that just the basics.
The
Have
basics is
somebody
good.
have somebody you trust to send employees to help
Hmm.
them make the right decisions. Send that letter of credible
Hmm.
coverage. And do you advise HR professionals to pay attention to the age of their employees and reach out to them at
Yes.
the 64th year and say, "Hey,
Yes.
you need to start thinking about this"?
I I honestly think that is a great service.
That's a good place to end it. And
Yeah.
that's all the time we have. Thank you for joining me, Nicole.
Okay. All right. Thank you for having me.
And thank you for listening. If you enjoyed this episode, please write us a review on Apple Podcasts, Spotify, YouTube, or wherever you're listening. And then share this episode on your favorite social media platform. It does help people find us. We see that all the time. And we'd love to hear your thoughts at goodmorninghr.com. Good Morning HR is produced by Marianne Hernandez and Paco Corral. And the theme music was created by Steve Pegler of HR Strategies of Texas. And I'm Mike Coffey. As always, don't hesitate to reach out if I can be of service to you personally or professionally. I'll see you next week, and until then, be well, do good, and keep your chin up.